Again, for those of you who don't know me, my name is Kirk Hosfield. I'm a member of the OnCore support team. Like I said, I'm here with Serena, who you might know from various email messages and the training messages that went out. This is what we call the pre-award training, or otherwise part 1 of the OnCore Financials Console. And it's okay to do the trainings out of order. So we have a second post-award training, or sorry, a finance training that's covering specifically post-award activity. And with that, we usually do participant introductions. I'm going to go ahead and skip that for now, but I just wanted to highlight that we usually have a pretty diverse group of people, and we're all here for various reasons. Some of us are here because we need to sign off and do the pre-award sign off on a particular study, and that can be a limiting step towards a study opening. Or you might be here in advance. Maybe you don't have a study that's opening for a few months and you're just trying to get ahead of the game. So welcome to one and all. The objectives for today's presentation is going to follow that you should be able to navigate the OnCore Financials Console. And there are many different parts of OnCore, so we're really going to focus on a couple. And I'll show you what I mean when we get into the system. After this, you should also be able to identify any errors, and that's really what we mean by this pre-award review, is that you're going into the system and checking to make sure that the calendar builder entered everything correctly per your contract or your financial documentation. And finally, you should be able to click that pre-award sign-off button. This slide is just to help illustrate that there are a lot of moving parts with OnCore. With today's training, we're really focusing on our clinical research management piece, as well as our billing compliance piece. But know that there are other aspects of the system, such as electronic data capture, biospecimen management, which I actually help configure protocols. So if you have other questions about that, I'd be happy to talk to you after class potentially. Patient registries, which are not active at our site, and ongoing integrations. Maybe one of the reasons why some of you are here is because we're, in many cases, creating a billing plan for UC Health or for Children's, and those are being stored in OnCore and then pushed over through the CRPC interface with Epic. So lots to think about. And you've all made it this far, so I assume you understand how this process works. But know that if you have to update your access for any reason, or if anybody new is joining your team, this process never changes. You'll always submit an access request form, then you'll attend a training session, and then afterwards, you'll complete and pass a certification exercise. And this applies to all of our trainings, save for the biospecimen management training. Ultimately, though, we are interested in getting this OnCore production icon. And some of you may actually already have this if you've already been working in OnCore under a different access role. Maybe you're a clinical research coordinator as well, so you're tracking subject visits. Then what this will do is it will amplify your access to the financials module in OnCore. And here's a little bit on the access roles I mentioned. You don't really have to pay too much attention to this slide, but just know that in the background, we have a lot of groups of permissions and privileges that are assigned based on what tasks you need to do in the system. So if you can't do a task, then you might not have the right permissions. And that always means usually a question to OnCore support. Some of you may already be familiar with this page, but we currently have 3 different places where we can submit protocols for OnCore. And if it's a new study, it's going to go to the Human Subject Research Portal. That's our catch-all. It's our most comprehensive questionnaire that lets us route it to the right people and make sure it has the right reviews to get up and running. If you have an amendment to said protocol, either a true amendment or a correction to an existing calendar or budget, then we're going to have you go to the amendment portal and submit there. And the last option, the OnCore build request form, is for anything else that doesn't fit into those first 2 categories. And right now, I think we're using it to migrate a lot of old studies that PIs want to include in OnCore. but have otherwise already been opened on campus. We refer to this as our 30,000-foot view because we're walking all the way over here on the left from submission to the HSR portal. Then we're assessing whether the study needs to go into OnCore, first of all. If not, it drops out. If it does, we go ahead and build a shell. A shell is, you can think of a bare minimum number of fields in order to create a sort of protocol skeleton from which we can build all of the other pieces on top. And you'll see that there's this bifurcation whereby we have two different routes, and we're working on this top branch on the calendar and the financials. So that's kind of our focus today. We're up here on this branch, and specifically here is our pre-award sign-off. And up to this point, what we've already had occur includes this initial calendar build review, meaning that maybe it was you, maybe it was your PI, or maybe it was someone else on your team. They actually reviewed the calendar and made sure that it was correct per the outline of the protocol. This is a pretty key step because everything builds on itself in OnCore. So we would want to make sure everything's correct leading up to. And up in this pre-award step is where the sign-offs actually start to occur. So this is the very first sign-off that a study team member will have. And so this means that we've entered the calendar based on the schedule of events, and we've included any financial information on top of that calendar. And that's when we have this pre-award sign-off. Then we have, of course, the research manager sign-off, and sign-off by the Office of Grants and Contracts, and finally the PI signs off before we end up releasing the calendar. I'm not going to talk about this other side in this training session, but for those of you who have attended protocol management or subject management, maybe you're more familiar with this. But this is where we're entering more protocol-specific information, such as IRB reviews, and there are other sign-offs here for the regulatory coordinator and the research manager again. So they get to sign off on both of these pieces. Finally, the study gets activated in Epic, if that's appropriate, and then we open it up to accrual. Then we can start registering subjects and checking in visits, and so on and so forth. Okay? Here's just another way to look at that, looking specifically at the sign-off process. Again, we're on the pre-award sign-off, and yeah, I mentioned that calendar review is going to happen first, then the pre-award sign-off, research manager sign-off, compliance sign-off, then finally the PI sign-off. Some OnCore basics for everyone who haven't been in OnCore already. Try to avoid clicking the back or the forward buttons in the browser itself, and instead use the buttons embedded within the application. Usually that could be a back button, or you can just navigate by clicking on separate tabs. If you do use the back or forward buttons, that's okay. The page may just end up crashing and you'll need to refresh it. Something to keep in mind. If a page is loading because you pressed submit to save changes to a page and it's still spinning, that's what this red box up here is for, then just give it a sec and let it ride, as they say. What we don't want to have is people pressing submit multiple times, because this might create duplicative records in the system, and that can cause some downstream effects. If a field has an asterisk next to it, that usually means that it's a mandatory field. And note that this doesn't include necessarily all of our institutionally required fields, or if your supervisor or manager has asked you to complete additional fields, these are strictly system mandatory fields. If you have the ability to edit a page, you may need to click update first. Sometimes OnCore will load the page and you'll be in a read-only mode. So you might need to click update first before you can start making changes. Once you make those changes, you'll need to click the submit button. There are a few exceptions to this. They're essentially submit buttons, but they are called something else. One example is an add box, where you'll enter a line of information, and then you'll click add, and it'll refresh the page with that information loaded. And there's another one that's specific to the post-award, which I won't talk about here. Lastly, In all of the tabs and pages in OnCore, you'll see little question marks, usually up in the top right corner of a page. And when you click on this, it'll link you to the vendor's learning portal. So Forte is the vendor that created OnCore, and it'll take you to their documentation, their guidance, which can be helpful in some cases when you just need a quick answer. Okay, and with that, I'm gonna switch into the demonstration mode. This is what my homepage looks like. Yours might look a little bit different in that you may or may not have these little widget boxes. If this is something that you're interested in exploring, you'll see that there's a little wheel. Let me try and zoom in a little bit. There's a little settings wheel in the top right corner. If you click on that, it'll bring you to a home screen configuration page, and you can add as many or as few of these as you would like. I tend to use reports pretty often, so I like to have this here, as well as saved searches and active tasks. That way I know what I need to work on. But you can also use the protocols, and if you're going to be working on 5 protocols and that's about it, maybe you can just have a direct link to all those protocols, and it'll save you a little bit of time from having to type it in. So something to think about. Otherwise, we're going to go back to, I'll just go to home so I don't confuse anyone. And I'm going to go back to that document that I had open a little bit ago. This one. So normally in the in-person training, we hand out these as for people to review while we're going through this. This is walking us through the pre-award sign-off. And these instructions will basically be updated on a regular basis. And we, as such, recommend that people go to that URL and actually review whatever we have posted there. Not that printing these out isn't something you could do if you're somebody who likes to have a paper version of something. In any case, all it's asking us to do is first open up OnCore, sign in, and then log in with our credentials, which we've done already. So I'm going to skip ahead to step 5, where it's going to talk about industry-initiated and industry-funded protocols submitted to the HSR portal on or after 11/28/2018. And again, this is only for industry-funded projects, but it wants us to look at something called task lists. We're going to go to Protocols, PC Console, and it's blank right now, so I'm going to type in training-protocol 1. Notice that when I type it in under the select protocol box, it's going to filter out based on the criteria and highlight the available options. So I'm going to click Training Protocol 1. Now this is all loaded. And I'm going to click on status. You can click on the double arrows and it'll be a little bit of a shortcut for you. But I'll go to status, task lists. Right, that's where it's asking us to go. It gives you a little navigation up here on how to find it, so don't feel like it's going to be lost. But ultimately, we're looking for the budget task list, which is right here. Okay, I'm going to click on the hyperlink for this budget task list. Okay, yeah, that's a little crowded for me. I think I'm gonna, yeah, just open that up for you guys. I'll keep referring back to that document, don't worry. But yeah, I don't want that screen to get too cramped for anyone. Okay, let's pretend that these were not entered already. You would pop in here for an industry-funded project and you would see that these are all blank. And what we're looking at is a list of tasks that we need to complete. Specifically, we need to complete B10, which is required, and B60, which is also required. And B10 is when the draft budget was received from the sponsor, okay? And the other columns that we can note are the target date, which you don't really have to worry about, but you can use if you want to set goals for yourself or for your team. The completed date is the one that I want you to worry about. This is when this particular task was actually completed. So let's say that we received the draft budget from the sponsor 4 weeks ago. So I'm going to do W minus 4. It's a little shortcut for you, week minus 4. And now I have the date from 4 weeks ago. You don't have to worry about owner either. You can ignore that. And then we got the budget finalized, let's say 3 days ago. So I'll do T for today minus 3.
Kirk, I'm sorry to interrupt. Are we supposed to be entering this information?
Nope, you don't have to enter it. You can just follow along with this part.
Okay.
Yep. Yeah, it might cause some errors if we all try to enter the tasks in at the same time.
Yeah, I can't enter anything on mine except for the NA section button. So that's why I was asking.
I think that's because we're in the train environment. On a normal protocol that you have access to, you should be able to enter just like I'm entering right here.
Okay.
Okay. So we've entered those, and we're going to go ahead and save. There's a save button up here, and so unlike the submit button, which is our general purpose, any form like area in OnCore typically has a save button instead. Exact same idea though. And we have a little success symbol. Great. And I guess here's some background as to why we need to enter this. Some of you might have heard of insights, and that's graphical dashboard representation of all manner of data coming from our protocols, so that PIs and leadership can take a look at this in a quick way, and maybe make decisions, or otherwise just evaluate how our performance is, our progress is. So this builds into that, and that's why we have required these fields for industry-funded projects. I'll go ahead and close out of this, and I'll jump back to our document, and this says, okay, yep, that's all good. So we're on step 6 now, a little too far. And it wants us to navigate to the calendar, right? We're going to review the calendar. And we typically offer this as an option for people, especially where we have a finance person and a coordinator who are 2 separate people, just to get another set of eyes on the calendar and make sure that everything aligns with both parties' expectations in this case. So we're going to navigate by going menu, ECRS calendars, specifications. That's the technical term in OnCore for what we refer to as the calendar. Okay, this is what the calendar is going to look like. Note that it's going to have our procedures over here in this left, this far left column. Then it's going to have all the visits up here on the top. And then in the middle, this is our matrix of where, when things are going to occur, and currently whether they have billing designations that are set to billable to the patient/insurance for SC, right? Or if it's paid for by the sponsor or research in whatever case. Okay, very basic. And what does it want us to do? I'm gonna switch back to my split screen. It wants us to review the footnotes the calendar builder may have added. And we do this by looking down here under the calendar footnotes section. I'm gonna scroll over a little bit here. And we just have a couple of footnotes from the calendar builder. This 001 footnote will be on every calendar that you see, because it makes sure that everybody's on the same page with regard to what protocol version or amendment version we actually used, along with a date for that. But we do have a separate one here, and it says when an unscheduled visit occurs, add visit using additional visits tab, and add the calendar procedure, unscheduled visit labor fees, to the visit in addition to the procedures performed. So we're just making sure that our coordinator remembers that in the case that we have an unscheduled or unanticipated visit, we can add this procedure over here. to that visit, right? Because it's otherwise not scheduled to anything. So done with that, we've reviewed the footnotes. Next, it wants us to just review the schedule for each calendar procedure for each arm, ensuring that this matches the protocol. And we can do this just by looking down, each procedure, looking across, making sure that it corresponds to the correct visits, whatever you need to do to make sure that that looks correct. Or if you have a good sense of the protocol, and then you can go ahead and make an estimate. Yeah, that looks good. Last, we need to just review the timing of each visit. I'm gonna undo my split screen again for this, because there's a little button over here called the Preview Calendar button. And if we click on this, like so, it's gonna pop up a little box, and it's gonna have us set hypothetical parameters and pretend that we actually have a patient, and we're gonna run them through the calendar. So I'll just keep this set to arm A, but you could alternate between whichever arms you want. Let's say the consent was signed today, and they started treatment today. And there are other dates, I'm gonna leave those blank. And then just click the preview button. And it's gonna refresh the calendar with not only the visit titles that we have, that the calendar builder set up, but it's gonna include hypothetical dates now for all of these things, and then calculate when the next visits should actually occur. And this can be really helpful if we already know ahead of time what our patient schedule looks like. So this can be a great way to make sure that the timing of each visit corresponds with our expectations. Okay? Any questions about that? That's all making sense? Okay, I don't see any questions. I'll assume that resounding silence means yes. We'll go ahead and look back at our worksheet to know our next step. Okay, now we actually get into the financial information. I'm gonna scroll down here, and it's gonna start with the parameters tab. So we're gonna go menu, financials, financials console, and then parameters. Of course, this is auto-selected when we go in there. So again, menu, financials, financials console. And just a note, I didn't mention this when we switched the calendar, but note we don't have to keep re-entering our protocol number, right? It assumes that we still want to work on this protocol when we navigate between different modules in the system. So that's a good point to keep in mind. Let's see, question from April. Some of the sponsor paid things require invoicing, while others are paid automatically by the sponsor upon receipt of data for the visit, but it looks like only are for both situations. That, we don't account for that necessarily on the calendar side. There may be instances where you get paid based on invoices received or created strictly based on patient activity in the sponsor database. And people can usually track that on the post-award side, but we won't track that aspect, what's automatically paid and what's not on the calendar itself. So, does that answer your question? Excellent, okay. The first thing that we have then is the parameters tab over here. That's auto-selected, right? And I'm gonna go ahead and scroll down and click update. And now I can actually show you guys some of the different options that we have. It starts, for those of you who are going to be following along on the worksheet, note that I'm just going to go right down the line from A sub I all the way down to sub I 12, right? So all of these are on this particular page. But it starts with the rate base, and it's currently set to industry. That's because our default sponsor is listed as Pfizer Pharmaceuticals. If this were funded by the National Institutes of Health, I would actually change this to federal potentially. Or maybe this is a departmentally funded study, and I would actually change this to investigator initiated, right? Those are the three options that we have. And our default sponsor, because in this case we only have one, we can just set everything across the entire protocol based on these two fields. If we had multiple sponsors, we would want to capture that under the sponsor settings box right here. So Pfizer Pharmaceuticals is down here. Let's pretend that Pfizer is just providing a drug for free, but it's actually an NIH study. Then NIH would actually be listed right below, and that way we would be able to distinguish the different rate bases for those different entities, along with any withholding percent. And I think most people are familiar with a withholding percent, but just to clarify, in OnCore, a withholding percent usually applies to industry-funded projects in the case where, let's say, Pfizer wants to withhold a certain amount of payment until after the data has been cleaned and validated in their database. And so usually this is an incentive that the sponsor will hold on to make sure that we do our good data cleaning methods. Then once we have a withholding percent, we need to decide where it should apply. Most of the time, it's going to apply to subject milestones or otherwise subject-specific lump sums for patient activity. In other cases, it might apply to something called protocol-related, which are specific to the protocol and not necessarily subjects. There are some exceptions, but for the most part, protocol-related will include things like IRB review fees, or pharmacy fees, or administrative fees, those types of things. The subject milestones that I mentioned are going to include one of two different items, either event milestones, which are things like screen failures, serious adverse events, outside safety reports, or OSRs. Those are all not assigned to a specific visit, but they do have to, they are a certain point in basically the patient's journey on this protocol, right? The other type then are visit milestones, which are specific to visits linked on the calendar. And lastly, but also specific to subjects, are pass-through items. The easiest way I found to explain those to people are, you can think of them as invoiceable items that the sponsor would like to see as their own line item on an invoice. These can include usually higher priced items like surgery or expensive imaging procedures. Sometimes the sponsor wants to see those as their own line item. Everything else can get lumped together under a subject visit milestone, right? So then this is just the other side of that. But they are complementary in that way. The next few are really more FYI than anything for your information, because we don't really modify them too much, except for this indirect rate percent. But we do have the ability to track, inflation and something called overhead rate percent, which in OnCore represents something over and above the facilities and administrative costs, or the F&A rate that you might be familiar with. The F&A rate in OnCore is actually the indirect rate percent. So again, the overhead rate percent, something over and above that, usually like a buffer that people can apply. Maybe they didn't include inflation, but they just want to have a general buffer across everything for 6%, right? That would be an example. We do track the indirect rate percent, not so that we can calculate those values in OnCore, but for reporting purposes and retrospective financial analyses, and just keeping that option available. Otherwise, settings for applications of indirect charges, meaning what should we do with this 28% F&A rate? We usually want to apply protocol-specific settings, and most of the time, these will actually all be blank. And because this is a training protocol, we wanted to show people what would happen if we did calculate the F&A within OnCore. So I've just selected two options here. And that's so that when we look in the post-award side, people can see that 28% being added on. This next section is at a number of cycles for budget calculations. And this is only required if a specification or a calendar is open-ended. And some of you probably already know what that means, but think of it as a calendar that can continue to repeat the visits so long as the patient derives some sort of therapeutic benefit or interventional benefit, meaning that they can just keep checking in visits as long as they want to, and within reason. But in this case, if we say, yes, OnCore, the calendar is open-ended and we don't know how long it's going to go on, OnCore says, okay, then just tell me how many cycles I should actually budget for. Most of the time, we at least have that much information. Of course, we do have a workaround that we apply here at CU that allows us to actually extend these so we don't have to keep re-upping the number of cycles. But I won't get into that. Just know that we got your back and we found workarounds to help. In this case, our calendar that we reviewed was not open-ended, meaning that it had a limited number of visits that will occur for each patient. So if that's the case, it'll assume that all of those might need to be invoiced, and so they're automatically going to all come over. And that's the point there. Moving into the invoice-related area over here, this is where we can define something called a screening failures invoice ratio, where the ratio is subjects that are marked as not eligible versus subjects that are marked as enrolled. Sometimes an industry sponsor will say, for every 2 patients that you enroll, you can screen fail 1 patient. That's what this ratio is trying to get at. And in this case, we need to define what enrollment actually means. And most of the time, this means whenever we put a patient on study, right, or they randomize them, or they're accrued. Another option is, in some cases, when a subject signs a consent form and is considered eligible, then that counts as an enrollment. I've seen that on a lot of federal studies. So normally we have the ability to change that, but because we've created invoices on this protocol, it actually locks this field, so I can't change that. Same with these fields, they're all locked. Then we have an initial invoiceable screening failures. Think of this as how many screen failures need to occur or can we invoice for prior to this ratio kicking in. So as it's currently set up, we have a 1-to-1 ratio where we need to enroll 1 patient before we can mark 1 patient as not eligible. Not eligible in OnCore means screen failure. And so what we can do then is we can initially invoice for 3 screen failures up to a maximum of 10. But as soon as we start on screen failure number 4, which is one above this, then this ratio is going to start to kick in. Okay? In the case that there is no ratio, what we typically will do is enter a 1-to-1 and then just enter the maximum number of screen failures in this area, this field. Okay? That can be a little tricky, so shoot me a message in the chat if that was a little bit unclear or if you want me to try to review that again. But otherwise, we need to do something similar for SAEs and OSRs and just indicate when we can start invoicing the sponsor for those. Usually it's right from the get-go, right at the first one. And lastly, there's something called the milestone invoiceable visit prerequisite. And it's a little wordy, but what it really means is, what does my coordinator, or what do I need to do in order for the information to travel from the CRA console or the subjects console into the financials console where I can actually start generating invoices. And usually we just want that visit to be marked as occurred and everything should flow over. If you need a little bit more control over what flows over, we can use other options here. We can wait until maybe the data collection has been completed, or we can wait until the data has actually been monitored and then it'll come over. And some of you who have already taken the subject management training may recognize these from the visit update page, right? There are those little dates that you can enter, and those are what's going to trigger these scenarios, okay? And last but not least, we have a remit to and a bill to section. I just want you to note that you can have multiple payers listed under the bill to, but you can only have one remit to address. Of course, this can always be changed in case anything goes wrong down the road. or if we have, multiple sites for some reason. Okay. Any questions on the parameters tab? Okay, I don't see any questions. We will press on. Next up is the protocol related tab. And I'll quickly navigate back to our worksheet over here on the right. So we've just reviewed all of this information down below, and now we're moving to the protocol related area, okay? And here, we just need to review all of the items that have been listed. And we're usually grabbing this information from the contract, I think is our most common document for this, because it has all of the things for startup and maintenance and closeout. So we need to make sure that the list looks accurate. Then we need to verify that items which can occur or be invoiced more than once are marked as variable. And then we may need to set up any triggers. That'll be the last thing that I talk about, okay? So to give you a layout or let's see what this looks like. You can ignore the event code and additional ID field. Those are really more administrative codes. What I want you to pay attention to are the event description columns and the comments, as well as the negotiated charge column, and then the variable column, which is the one that we just talked about. The event description should usually be pretty close to what you have in your contract. And if ever there's any confusion or a little bit of uncertainty, the calendar builder will usually enter in a comment to clarify what item we're talking about. And then, of course, the negotiated amount should align with that item. There are a few other charge columns that we can ignore, like retail and research. We don't pay much attention to those in this area. The negotiated, though, should match your contract's final amount with the sponsor, okay? Or in the case that it's a federally funded project, maybe it's just the administrative startup fees that you need to do anyway, right? To track your operational costs. And then there's that variable column I mentioned. So this will be anything that has this variable checkbox marked means that it could occur variable number of times. In this case, variable doesn't mean that it's a variable cost, just the frequency on which it occurs is variable. And if it is a variable cost, we have a different way to deal with that. And that is our penny value that you can see down here for our standard translation fees. And that's because we typically don't know how much a translator or a translation is going to cost until it's been performed, right? So the cost itself is variable, but it's also a variable frequency in that it may occur more than once, okay? Everything else, I think we've covered. Let's double check the worksheets. And yes, the protocol related triggers. And there are separate instructions that it'll link you to over here. And I'm just going to show you what that might look like. This is a pretty new feature, and we decided to include it in the pre-award training because this is where the most likely place is that study team members will actually add those. And there's one trigger in particular that I want to show you. And I'm just going to go ahead and click on advanced payments. And looks like it's already been set up. Under the trigger over here, you can choose one of 3 different trigger types. 2 of them are based off of IRB statuses, like IRB review or IRB study closure. And then there's a third called CRA consult. And the cool thing about this is it basically streamlines our ability to have triggers for people who may otherwise not have access to the financials console. So if you're the finance person and your coordinator is somebody who's going to know when a specific item is going to occur, I think of dry ice when I think of this for shipping samples, or maybe the translation fees or things like that. The coordinator can trigger that from the CRA console. So if, in this case, We just had to come in and set this up. Let me see if I can find a blank one and just show you guys what that should look like. Here we go. So here's a central lab processing fee. And under this trigger type, I'm just going to select CRA console, automatically selects yes, and then click save. And you guys can feel free to create some of these if you would like, one way or another. You may need to click select the button down here and then actually just find a random item to grab, like a generic protocol fee, for example. In any case, did I close that window? No, I did not. Okay, so back to, here's my central lab fee. I'm just going to clarify that this is maybe for sputum collection, okay? And this is going to be in the amount of $300, well, maybe that's too much, $33, we'll say. All right, and then I'll click submit to save. Okay, all of that information is saved for me. Now I'm going to take a little tangent. You feel free to not follow me unless you would like to, but I'm going to go to the CRA console and show you what this looks like in this module. Notice that there's a new, relatively new tab called Financial Events. And if I click on that, you'll see that there are a bunch of other items that we've added. But in this case, I'm going to go ahead and click Update and add some new items. So this financial event field will populate with everything that we've labeled as a CRA console, as having a CRA console trigger. And here's that central lab processing fee that I just made. So I'll click on that. Let's say the occurred date was today, sounds good. And I'll just do the one count, but if it's a variable item, we should be able to enter multiple, right? Maybe it was 2 sputum collections. I'll just keep the 1 for now. And maybe I'll just leave a note for my finance person. Something like that. And then when I click add, it's going to refresh and populate that down here. Great. If I made a mistake, I can of course go ahead and delete it. But now I'm going to jump back into the financials console and show you where that actually came over. And it's actually in the invoiceable items tab, which I generally talk about in the post-award training, but I'm going to give you guys a little sneak peek in case you haven't already been here. And voila, here it is, my central lab processing fee. And it'll, of course, bring over the comments that I entered in the protocol-related tab to clarify what this is. So I know it's for sputum collection, but it's also going to bring over any comments that the coordinator entered in the CRA console. So if I hover my mouse over this little question mark, it'll say sputum collected in a cup. Okay, that's great. And now I can then go ahead and add this to an invoice. So now you see we've gone from how we can leverage that kind of trigger with, maybe the insider expertise of our coordinators, in that they might be the best person to know when that actually occurred. And now I can create an invoice off of that. Okay, that's an option for you. And now you know. I'm going to go back to I'm actually going to go to the subject related now that we're done with the protocol related. But were there any questions about protocol related tab or the CRA console trigger? Okay, well, the chat box is open if you guys have any questions there. Welcome to the subject related tab on this protocol. And you'll note immediately that this kind of looks like the calendar, right? Well, that's because all of these procedures are the ones that we saw on the calendar. So it also has a few others that were not on the calendar. And if you look very closely, you'll see that there are little asterisks to the left of each of those procedures. And this means that, according to our legend over here, that this is a budget-only procedure or item. And in this case, these are labor fees, or this bottom one is actually a workaround for a visit milestone that I'll talk about later. But in some cases, our study teams want to track labor on a per visit basis. So OnCore can do that by adding budget-only items that we otherwise don't want to see cluttering up our calendar for the coordinators, but we still want to track from a financial standpoint nonetheless. Okay, what else can we see on this page? We can see that there are 3 different charge columns. That looks familiar. Retail, we can ignore. Research is more meaningful in this area, this tab, but unfortunately, we don't know what this research value actually corresponds to. And I'll show you what I mean. If I click this expand all hyperlink over here on the left, I'm going to see that there are multiple charge events that are embedded within each of these procedures, right? Under serum chemistry, this is actually constituted by creatinine, blood, and C-reactive protein. And in that way, I don't know which costs what, right? I just know that together they amount to $27. And same thing with that research amount under this 1280 kg. I don't know how much of the 213.94 corresponds to the electrocardiogram itself or the interpretation and read of that electrocardiogram. So this is kind of a snapshot that's, I think, limited in use from my point of view, but I think it is nice. I'm going to go ahead and collapse all those because of the charge type column. And if we're just quickly reviewing what charge types we're expecting for each of these procedures, this might give us a good sense of what we're seeing. And in this case, we have 4 different charge types. We have this N over here on the top, and that means not billable or not applicable. And most of the time, we reserve that for items that may be bundled under other procedures or services. You may see this commonly, you may see not applicable charge type common among vital signs. And if, for example, we have a physical exam and a vital sign, if the vitals is considered part of that procedure anyway, we're just going to mark that vital signs as not applicable because they're not separately billable in that instance. So that's not applicable. Anything that says S, SC, S1, or S0, those are all standard of care, right? So S is for standard of care. M is going to be milestone. And if you think back to what we were looking at in the parameters tab, this could include a visit milestone in this case. So for in this case, we have a serum chemistry procedure with these labs in the amount of 27, and we really don't need to see all of those items as their own line items on an invoice. Instead, we're just going to bundle them with the overall visit milestones on which they occur. And I'll show you a little bit more about that in a subsequent, in the budget calendar I'll get to. If we do want it to appear as its own line item on an invoice, then we have P for pass-through. That's the other side, right? Those complementary. Both of those are billable to research or the sponsor, but they have different functions. So the unscheduled visit labor fees are, in this case, going to be pass-through, meaning that we will see them as their own line item on an invoice. And we also have this one I'll talk about later. Okay? But we also see that there are sometimes multiple charge types. And this, while it's helpful to know that we have both pass-through and milestone on one item, we don't know which visits those are, right? So our, again, I feel like this is more of a limited snapshot of what's going on. If we really want to dig into what's going on, we are going to use something called the budget calendar tool. And if I go back to our document, that's what it's going to ask us to do. Utilize the budget calendar tool at the bottom of the page to, verify procedures across visits and confirm billing designations and charge types. So let's go ahead and try that. I'm going to go ahead and click budget calendar. It's automatically going to select the latest version of the calendar and the latest version of the budget as well. Okay. Optional segments will only apply in the case that we've added optional segments to the calendar. And for the purposes of this review, I would say just make sure that you add any options that are selectable. Okay. There are none on this protocol, but we'll go ahead and click submit. And now we can see a budget calendar, right? There's some filtering options over here on the left. You can filter by sponsor or by protocol arm or by charge type. So if you just wanted to see everything that's billable to standard of care, then I could select that and it'll remove or unhighlight anything that's not standard of care, right? But I'm going to change that back. There are some people who ask us if they can use OnCore to actually guide some of their budget negotiations from the very beginning. And to you, I say kudos, because you can. And what you have to do is come into the budget calendar tool, and under this use cost option, you need to change this from negotiated to research. And by doing that, you're actually going to have OnCore display the research rates based on the sponsor, right? So if you think back to our parameters tab, our default sponsor is Pfizer Pharmaceuticals, and our rate base is industry, right? Because it's an industry sponsor. And that translates over here in the subject related tab in that these are going to display all of the industry rates for these specific procedures. Okay, so in this way, you could use the budget calendar to kind of guide your budget negotiation. And this is by no means required, but there are a lot of study teams who find it helpful in the initial startup phase for a study. In any case, I'm going to go ahead and change this back to negotiated because that's for study startup. Right now, we're actually approving the calendar and the budget in OnCore. So we want to make sure we're using our negotiated rates. Okay, so that's all there. If I scroll a little bit over to the right, note that it's going to break it down by arm. So we have arm A up at the top, and then arm B is down below. And what we're going to see is these little expansion symbols that we can click on. Remember our conundrum with the serum chemistry? We didn't know what costs what. Well, if I click on it here, now it's giving me a breakdown. Creatinine of the blood is $9 and C-reactive protein is $18. And those are industry rates for these procedures. Okay, that's a little more helpful. And this may actually look kind of like your internal budget because we have all of our procedures on the left and all of our visits up in the top row over there. Now it's becoming a little bit more helpful. You'll note that anything that had a pass-through charge type just has a P listed here and no value. Even if I open this expansion symbol, right? It just says P right here under the screening visit and then $19 under subsequent visits. And this is the one where we had a pass-through charge type and then we had milestone for the rest of it. And the reason they do that is because they break the pass-through items out separately into its own groups down here. Anything that's considered regularly scheduled is going to be in the top one. And you'll see that that end of treatment milestone that I'm going to talk about later is over here, set to occur at the end of treatment visit. And that's on purpose. It's a workaround for us. But here's that pregnancy test that we were looking at. Okay, so now I have the CPT code. This is the charge event. And I know that this too is $19, but it's marked as pass-through because we either want to account for it on our invoices or the sponsor wants to account for it in their records. Okay? It's a lot of information, I know. And something else to keep in mind, this visit total is only reflective of whatever has a milestone charge type within this column, right? So it's totaling all of these amounts. It's of course excluding anything that doesn't have an amount. And this is the total. So this might be close to an estimate for our screening visit, but this is not the milestone amount that we set up in the system. And it's a future enhancement request that I've submitted to Forte and hopes that they might do that one day, because I think that would be more beneficial. Now, because this is a relatively small calendar, relatively few events, it's pretty, this is pretty manageable on this page to look at it like this. In most cases, we have upwards of 40 procedures over here on the left, and sometimes 50 plus visits over here on the top row. That kind of a grid becomes much more unwieldy. And to overcome that, we recommend that you export this into an Excel file. Then it becomes maybe similar to what you already may know in practice. So I clicked Export to Excel. A little queued tasks message is going to pop up. And then when it's actually ready for you to review the results, click View Output. Okay, I'm going to close that window. Notice a little dialog box opened up here, said we're ready to open it. Aha, okay. Now we're in Excel. I'm going to click Enable Editing. This is just some basic protocol information. And then it's going to separate these based on the arm in this case. And I'm going to modify this just a little bit, make this a little bit easier to view and zoom in a little bit for you guys. Okay, I like Excel a lot. I use it often. One of the reasons I recommend it is because if we do have tons of procedures and tons of visits, now it makes way more sense to come in here and use the freeze panes option, right? So that it locks in my visits, and I can go right down the line and I'll know whether for each procedure that the billing designation is correct, that it occurs on the right visits, or that the amounts are correct as they're displayed. Okay, that's the basic idea here, and why I showed you how to export this into Excel. What else can I show you? There is a symbol here that looks like a cross symbol on the phlebotomy procedure. And if I scroll down to our legend, this is marked as a procedure alternative. And this means that of all of these procedures that are listed, we can only have one occur per visit. Okay, so we can't have multiple. If we do need to have multiple, maybe we would let the calendar builder know that this needs to be changed and not marked as a procedure alternative. But as such, these are all mutually exclusive options. And this might make a little more sense to those who have already taken the subject management training. But when a patient comes in and they need this phlebotomy test for the serum chemistry labs that they're going to have either a blood draw by venipuncture, or if they're in a different population, they might need a VAD port or a PICC line or something like that. Those are all options that would be listed under here. These two are the same procedures but performed by the research team. So we know exactly who's performing what in the case that it's primarily going to be performed by the study team, but the hospital may serve as a backup, for example. Then we have all of these options captured together under one calendar procedure. So that's a favorable circumstance for us to have. Okay, and I think that is it. Are there any questions about the budget calendar tool? Actually, I'm going to go back to our document, make sure we checked everything, right? We verified procedures across visits, and we confirmed our billing designations. And yep, that's all we needed to do here. So if there aren't any questions, I will go ahead and press on. All right, so I'll X out of here. And to go back, I'm actually going to use the back to protocol budget criteria button in the top left. Then I'm going to click back the button. And now we're back to where we started. The budget calendar tool is really helpful, and that's what I would recommend that most people use to review a lot of the information. But there are a few things that we can only review in different ways within OnCore. So I'm going to click on the 12-lead ECG procedure over here. And as soon as it loads, it's going to give us a similar breakdown that we saw in the budget calendar tool, right? It's going to tell us the CPT code, the charge event description, and it's going to give us some event charges that we're used to seeing, right? Retail, we can ignore. Research is going to be the industry rate for this procedure, and then our final negotiated amount that we have with the sponsor. And some other things. In this case, do we have indirect that applies? What's the charge type? In this case, it's billable to the milestone, meaning that it's going to be lumped under that visit milestone. And we have this section, which is not in the budget calendar. So we have hospital as our conducted by, and our cost center, if we click on this hyperlink, we see that we have Children's Hospital of Colorado and University of Colorado Health Metro Denver. Okay, so if we are having this study occur at those two sites, then we are good to go. We don't need anything else. Let's say that we're going to have some patients seen in Denver Health. Well, then we would actually need to make sure that Denver Health is selected as an option for the cost center. Okay, so I would select here and I would click submit. And now I know that Denver Health is going to be an option when we perform this EKG. All right, that's something that we can't see in the budget calendar tool, but it's also something that most people probably don't want to review on a line-by-line basis, right? So what we did is we actually created a report for people. And so I'm going to take another tangent. Feel free to follow along if you would like, but I'm going to go to the reports module. And you can get there by going to menu, reports, reports. And it's going to open up here. I'm going to click on the financials reports group. And this is the report that I'm interested in, protocol specific cost centers. What it's going to do is tell us all of the cost centers that we have across all of our procedures on the protocol. So now it becomes less of a line-by-line review and more of a, a clustered analysis. I'm going to type in our protocol number, training-protocol 1. Oh, I think I have a spelling error somewhere. Yeah. Training protocol 1. And I just remember that we're on calendar version 6 and budget version 1. And I'll also export this as Excel for now, and then click submit. And same thing, we're going to have a little dialog box in the bottom left so that I can open a new report that's going to show us all of our cost centers. And I'll click enable editing really quickly. It lets me. Okay, so there's just some basic protocol level information over here on the left. So I'm going to scroll over to where we can actually start to see our calendar procedures, right? So here's that 12-lead EKG that we were just looking at, and our, our different charge master events that we were seeing. And what it's going to do is show us each charge event, right? This is all the same 93005, the technical fee for the EKG. And then it's going to show me all of my cost centers that are listed on that charge event. So this is how we could use the report to identify, in this case, maybe Denver Health is not supposed to be there. So I could go back, make a note, and say, calendar builder, we need to remove Denver Health as an option, or if we need to add any options that are not listed across some of the other procedures that we have. Okay. So feel free to use that report. I think it would, as a calendar builder, I tend to run this report before I release calendars, just as a double check for myself, but I would recommend running it while you're doing your pre-award review as well. Okay, I'm just gonna X out of these. We're back here. All right. And what else do I need to do? Let's go. A question, who in the chain knows which cost center will be used? Don't think we'd know that in the post-award when doing pre-award review. So usually we need to have some plan as part of the protocol design for who's going to perform what, especially in the case where we have the CTRC involved, for example, perinatal or children's or adult CTRC. We would need to know ahead of time that they're actually going to be performing certain procedures so that we can build those into the calendar. So hopefully that somebody on the clinic team knows that that's the case, or the PI may know, but someone on your team should know. And if that's not apparent, we can of course reach out to other people at those vendors, like Pam Allen at CTRC, and double check in certain cases whether or not we need to include other vendors for services like that. Does that answer your question? Okay, I'll keep going. Hopefully that answers your question. Next we have, all right, I already went over all of this with you guys. Subject related, yep, just confirming this. And this is just a little note. By confirming the billing designations and the charge types for the procedures and signing off as the pre-award sign off, it's considered approval of the billing plan as it pertains to UC Health and Children's, meaning that we need to make sure that that's right. And there is a separate place that you can go and review that information for the billing plans specifically. And as another tangent, under financials, coverage analysis console is where we can find this information. And it's going to have a procedures tab that we can click into. And this is where a hospital review specialist would come in and enter in supporting designations and comments for how they made determinations for what could be covered by insurance and what needs to be billed to research. Okay, so if you have any questions or concerns, they always leave comments and supporting designations in here. It's also helpful to have your PI review this information maybe with you, just to verify that all of this aligns with their expectations. Okay, done, tangent over, and back to our worksheet. So we verified that all of these are correct, and we're now on the milestones, our last section that we need to review before we can sign off on the calendar. And to go there, we just need to hop over the receivables. This is actually just a title, and they tried to make this apparent by doing, a 2mm indentation here. Same thing with the budget. So these, we can't actually click on those. They're just headers, but we do need to go to milestones to check on our last area for review. And this is the most straightforward area, in my opinion. It's just going to list all of our event milestones. Remember, those are things like screen failure, serious adverse events, or outside safety reports, and then their total negotiated amount, right? You can ignore the total negotiated costs, which are calculated by OnCore. Sometimes this can be helpful, but for the most part, these are not the finalized rates, and it's just going to add all of the milestone values together. Okay. And let's see here. Then we have our screening visit here, along with a breakdown based on the arm, right? So arm A it's alphabetized up at the top. and then arm B is down below. And if you'll recall, we actually had 4 cycles of treatment. So maybe this would be an opportunity where I would say, hey, calendar builder, it looks like we still need a couple more milestone cycles included here, or otherwise figure out what's going on. And we also don't have our end of treatment milestone. And now I can go back to that workaround that I mentioned in the subject related tab. So let's do that. In cases where we have differing amounts for a given visit, let's say that arm A is going to be $1,000 on the end of treatment visit, but subjects on arm B, it's going to be $500, right? That's a pretty stark difference. Sometimes that can be true. And in order to work around that, what we do is enter in our penny value, our placeholder, in order to flag the post-award person and make sure that they know they need to look into this a little bit further. Because what they'll see is that they get this, this milestone visit in the invoiceable items tab when they're ready to create an invoice, but it will have the value of a penny, and nothing costs a penny in research, right? So it's just supposed to be a flag that they need to look at this the patient a little bit more closely and figure out what the true price should be, okay? And again, this is just a workaround that we use because OnCore doesn't have a great way to capture this. Because if I had captured this on the milestone, like the others, there could only be one milestone price. So anything that would differ by arm is unfortunately lost, okay? All right, and now where are we? So we reviewed the milestones are correct for each arm, and we made sure that the subject-related milestones are not also captured in the milestones. And we did check. In this case, we would want to make sure that we don't have an end of treatment milestone in both places, right? It should be one or the other. All right, and invoicing rules are another place that we can explore if you are interested in more automated invoice creation. If you are, just send an email to OnCore support and I'll work with you directly. And know that we have an attachments area that you and your study team are free to use as much or as little as you would like. I assume that most people on our campus use shared drives for most things. So this hasn't been too applicable, but the option is there if you need it. Now, what do we need to do? If any changes at all are required, then we're going to email OnCore support and just list all of those changes or clarifications out, and we'll address those line by line for you in a separate email. Okay? Otherwise, if we're ready to go and we're ready to sign off on this calendar, then we're going to go ahead and navigate back to our specifications area. Okay? So we're going to go to menu, financials, oh, sorry, ECRX calendars and specifications. Okay, so we're back here, and I'll just pretend that that one hadn't already been signed off on, but this is what you would see. You would come down here, the status would be incompleted, and we would have a pre-award sign-off button ready to go down here. And only people who have the pre-award access role in OnCore should see that button. So if somebody else in your team says it isn't there, that maybe means that they don't have the financial access to actually sign off on it. All right, but when we're ready to go, all we need to do is click that button, and we are set. What's going to happen is the research manager needs to come in and do their sign off. So they're going to receive a notification from OnCore support and link them to a separate URL with separate sign-off instructions. Okay? And last but not least, remember those question marks that I talked about? Maybe it's more meaningful if I come over here, but all of the question marks are basically in the top right of every table. So if I click on that, I'm now linked to ensemble.net, which is Forte's website. It's their learning portal. It'll automatically select the correct version of OnCore for our site. and it'll link you to all of the information relative to this page, right? So if you want to look at what is rate, I don't remember what Kirk said about rate base. What does that mean? Or what's that withholding percentage in the purview of OnCore, or other things. So this is a great resource to quickly get at questions without having to send an email. So that can be nice to have. You guys have a lot of resources at your disposal. You have your colleagues who have probably already taken some of these training courses as well. And they're a great resource to troubleshoot and help you navigate maybe some of the more basic and fundamental concepts within OnCore. You can always reach out to us with any questions, of course. And we have a website where you can review information like guidance documentation or sign-up instructions, and it'll link you to our OnCore SharePoint. Make sure you read the weekly announcement email that Amanda Child sends out. It has a lot of important process updates. We typically send this out weekly, but currently I think we're more on a daily or every other day basis, just to make sure everybody's in the loop with all things OnCore. And I did mention those question marks, so you can always check out there. You can actually make a full Ensemble account. If you do so, just make sure you use your cuanschutz.edu email. And like I said, you can email us with questions, or you can stop by for virtual office hours right now. And I believe I can't remember if we send out that link in the announcement email or if we have it posted on our website. But if you want to attend that, just send us an email and we'll make sure that you are connected.